Having a baby is a really special and exciting time, but we also know that it can be quite daunting and that you will have lots of questions about your pregnancy and about having the baby. This film will show you some of the services that we have on offer and will also help to answer some of those questions for you.
Once your pregnancy is confirmed, you'll need to make an appointment to see your midwife at your doctor's surgery. This appointment will take about an hour, and it gives an opportunity for you to meet your midwife and for the midwife to go through your past medical history and anything that might be relevant to this pregnancy. And it gives you that opportunity to talk to your midwife about any concerns that you might have. The frequency of your antenatal appointments actually depends on whether it's your first baby or your second or subsequent baby. If it's your first baby, it's generally by your midwife in the GP surgery, or it could be in a community centre or a children's centre, and occasionally in the hospital. The frequency of your visits is normally about 11 visits for your first baby. If it's your second or subsequent baby, probably only about 9 visits. But obviously if there's a cause for concern, then more appointments will be made for you. When parents are preparing for labour, we invite them to come along to some parent education classes that are at the hospital over the weekends. These are 4-hour workshops that are offered to first-time parents. We also offer specialised classes to parents that are expecting more than one baby, so multiple births, teenage pregnancies. We do fathers-only classes, and for the breastfeeding workshops, which are preparing parents for breastfeeding their baby.
Because it's our first baby, we really don't know what to expect, so it's really been helpful. It's such a small group, a cozy group, and we've had all our questions answered. We've got so many concerns. You don't know if this is the first time we're doing this, so it's really been helpful.
Just see them face there.
During your pregnancy, you'll also have 2 ultrasound scans.
Ultrasound is one of the prenatal tests that's offered to all pregnant women. It's non-invasive and it's safe and very easy to perform. All women are offered a 12-week scan and a 21-week scan. At the 12-week scan, we date the pregnancy. It's also very reassuring for the parents to see a nice heart beating. We can tell them how many babies are present, and at this stage we can also offer screening for Down syndrome. At the 21-week scan, we check for any structural abnormalities, make sure that the baby is growing normally, and make sure the placenta is clear of the cervix. This is the last routine scan that you will have, and any further scans are requested by the midwife or obstetrician.
Towards the end of your pregnancy, don't forget to pack your overnight bag. You don't need to have too much in it, and it doesn't have to be a very big bag, because believe it or not, there's not very much space and people trip over it.
For labour, we've also got a wide range of facilities available. Some mums choose to have their babies at home, and if that's your choice, then our community midwives will look after you.
In the community, we deliver approximately 150 babies at home per year. If you're interested in having a home birth, be it your first pregnancy or subsequent, you will discuss this with your community midwife, who will then arrange a home visit to discuss the benefits and the preparation with you and your partner.
If you're having a baby in hospital, then we want to keep everything as natural as it possibly can be, and we encourage you to be up and about and as mobile as you can in labour.
When you think you've gone into labour, we tell you to ring the triage unit at St Peter's Hospital, Abbey Wing. It's open 24 hours a day. During the day you use the daytime entrance, and at night time you use the nighttime entrance, and it's on the first floor. When you arrive at triage, you'll be met by a midwife who will have a general chat with you to see how you've been getting on in your labour. If you appear to be in advanced labour, then we take you straight upstairs to labour ward. However, we normally assess you in the triage, and if you appear to be in early labour, then we may advise you to go home, but don't worry, you can phone us as many times as you like.
When you come up to labour ward, you'll meet your allocated midwife, and she'll show you to a delivery room and discuss with you any preferences that you have for your labour and delivery, and may discuss a birth plan if you've written one, and if necessary she may perform another assessment. Your midwife will encourage you to be as active as possible in labour if your circumstances allow. We do have a number of pain relief options available. We have piped Entonox, gas and air available in every delivery room. We have water facilities. We have some stronger pain relief options including pethidine and a 24-hour epidural service if needed.
Our ensuite birthing rooms have recently been refurbished to a very high standard, and we've also got a new birthing pool.
We're really pleased to be able to offer a birthing pool here at Ashford and St Peter's Hospital because there's lots and lots of benefits for mums in labour. It's an excellent form of pain relief. Mums feel very weightless and babies are very happy when they're born in the water and quite often don't cry after they're born because they are so relaxed and so calm. Mums can also use gas and air in the pool, and any mum that's used a water birth always says how fantastic it was and they definitely choose to use it again.
We have a great team here on labour ward at St Peter's with excellent facilities, and we encourage you to have a normal birth. But should your pregnancy or your labour become high risk, we also have a team of obstetricians and anaesthetists who will help to care for you.
Once you've had your baby, you come down to Joan Booker Ward, where you'll be cared for by a team of midwives. We've got maternity assistants and also nursery nurses who will make sure that you and your baby are cared for and confident before you go home.
The labour was fine. It was very easy, very quick, and the experience was amazing, really nice. The postnatal care has been very good, outstanding. I've had a lot of support with breastfeeding. All the necessary checks have been done, and I found the experience very good overall.
If you're hoping to breastfeed, there will be plenty of help on the ward. Please don't hesitate to ask. We're there to help you night and day. Security is very important to us. We have got cots with alarms next to mum's beds, we have got locked doors, and we've also got CCTV. Having a baby is an exciting time, and there'll be lots of people wanting to come and see you. Your partner and your children can visit anytime. Visiting times for friends and relatives are restricted. Please inquire beforehand. Unfortunately, children under 16 who are not your own are not allowed to visit.
One of the things that sets us apart from other maternity units locally is that we have a neonatal intensive care service. That means that other babies who are born locally that need that help would be transferred in to have their care here at St Peter's.
Here on the neonatal intensive care unit, we take babies from 24 weeks gestation up till term, any baby that may be poorly at birth or just after birth. We also take multiple births, twins, triplets or more.
I think the care on NICU is absolutely amazing. I mean, the nurses, the staff here are unreal. The carers, they make you feel so comfortable and calm and relaxed. As you can see, we've got a gorgeous little boy now, and that partly is all made to the staff and the nurses here at NICU.
There will be plenty of opportunity for you to discuss your birthing experience with the community midwife. If, however, you did feel you needed extra support, we have got the birth reflection service available.
The birth reflection service here at St Peter's is fairly unique. Not many hospitals have a service like this. And what we do in the birth reflection service is we invite parents, if they would like to, or they can self-refer, and they can come back and reflect on their birth in an environment that feels safe. They can work through difficult emotions, especially if parents have had a traumatic birth.
Yeah, the birth reflection service was very important to me following the birth of my first child. It really helped me understand what had happened during the labour and the delivery, and then to help make sense of how I felt postnatally. And that in turn helped me approach a second pregnancy. And then during that second pregnancy, I had help and advice and support, and it ended up being a much better experience for me.
Once you leave the postnatal ward, your care will continue at home. The community midwives, who you may in fact have met during the antenatal period, will continue to provide that care for you and your baby. One of the things I'm really proud of as a head of midwifery are the friendly, caring staff we have here at St Peter's. They go out of their way to make sure that the experience you have is the best it possibly can be. This has been recognised recently with 3 national awards. We hope you will choose Ashford and St Peter's to have your baby, and if you have any further questions, please do not hesitate to contact us.